Would you get arrested if it meant having the hair of your dreams? So here's the story. Eugenio flew from Las Vegas to Miami for a hair transplant and liposuction. He then got on a flight to go home from Miami on post-op day 0, which is the day of surgery. He was able to pass security and board his flight, but passengers saw this bloody situation and started to complain and reported him to the flight crew. He showed the crew his paperwork, which said that he was cleared to fly and to go back to work with no restrictions. More on that later in the video. The flight crew did ask him to get off the flight, but he refused since he felt that he had done nothing wrong. But police came on board and removed him and his wife, and they both got arrested. Some even say that he got pepper sprayed. Wow, that's a lot of drama after a hair transplant. Here's a photo of him leaving the flight handcuffed, with his wife streaming on TikTok. Lots to dissect here from a surgical perspective. Let's start with the topic of combined procedures. It's reported that he got both a hair transplant and liposuction. Let's assume for a moment that maybe those were done on the same day. How often are procedures combined with a hair transplant? Well, the answer is not too often. Hair transplants can often take all day, with many people in the room and the patient having to change positions throughout the day, so it's difficult to get many other procedures done on that same day. Also, you have to be careful not to exceed lidocaine limits so that you don't get lidocaine toxicity, which could be fatal. We have a video on risks and potential complications of hair transplants where we go into that specific potential complication in detail, so make sure to check that out if you're interested. Similar to a hair transplant, liposuction often requires decent amounts of lidocaine over the course of hours, and that in combination with a hair transplant can now raise that level of lidocaine in your system and potentially bring you closer to toxic levels. So that is why that combination of procedures is actually quite uncommon. Now let's talk about the topic of leaving the office with a covering on your head versus no covering at all. They seem to have sent him out with a bandage only on the donor area, which is the back of his head. The issue with this type of bandage is that, first of all, it's not really too secure because there's nothing holding it fully in place. As you can see, parts of it are starting to come undone. There are some clinics that send people out with a covering that goes also along the lower forehead. That at least secures the bandage better. But the reason why in my practice I don't like bandages like that is because when people go home, there is sometimes some dry blood underneath the bandage. And as the bandage gets removed or comes off on its own, that could actually lead to more active bleeding because there could be a blood clot that now gets pulled off and bright red blood can start to leak. And the reason why I don't like a bandage that wraps around the front of the head is that now your grafted area, assuming you worked on the frontal scalp, is potentially at a higher risk of having some displaced grafts if that bandage were to creep up and affect that transplanted zone. I prefer patients leave the office either with no covering at all or a surgical cap similar to this one, a little bit different, that gets placed on the head by us as the patient is about to leave the office. That typically covers the recipient area fully, and it covers part of the donor area. So things generally are a lot less visible and less scary to people who are around you when you're fresh out of surgery. It's really a much cleaner look, and I wonder if he had a surgical cap on his head, could all of this have been avoided? Now let's talk about traveling immediately after a hair transplant. It's definitely not great to fly the same day of your surgery. I think it's best not to travel far for at least 1 to 2 days after surgery. It's just too fresh. There's too high of a risk of bleeding, of graft disruption, of just like increased swelling, and you're really just not comfortable right after the procedure. It takes at least 24 hours for you to just feel better because you just had the procedure. Of course, your body needs some time to heal. Most of my patients go home right after surgery if they live locally, or they'll stay at a local hotel for 1 or 2 nights post-op before they travel back home. And that seems to work out great. Now let's talk about the potential of bleeding after a hair transplant. The donor area after an FUE procedure can have some light bleeding for about 24 to 48 hours. And this is because there's sometimes that thousands of these small little holes that need time to seal up. And as they heal with small crusts and eventual re-epithelialization of those small holes, you sometimes will have some spots of blood, like onto your pillowcase, for example, or potentially the back of an airplane seat, as in this case. And it's very rare to have more bleeding from that donor area, especially if all bleeding is fully controlled before someone leaves the office. Now, the recipient area only actively bleeds if grafts are disrupted. The grafts at the recipient area are essentially plugging up all the little slits that were made for the recipient sites. So there's no active bleeding unless one of those grafts pops out, and now you have an area where you could have a streak of blood. In Eugenio's case, his transplanted area does look a little bit messy. It's unclear if some of his grafts were dislodged or if the upper forehead was just not cleaned thoroughly before he left the office. Of course, wrestling with police officers does increase your chance of dislodging grafts. Now let's talk about some of the restrictions that we place on patients after a hair transplant to ensure the best possible outcome. His paperwork said that he has absolutely no restrictions, but let's go over what type of restrictions might exist after a hair transplant and the reason for them. One general precaution that I like to give my patients is to not raise their arms above their shoulder level for at least the first 3 days after a hair transplant, unless they're in front of a mirror, which, as Eugenio was giving an interview, he was doing. You could see him bringing his hands up to his head, and he's not in front of a mirror. And this is to reduce the chance of someone accidentally rubbing on their grafts because they are numb, let's say, and they don't realize that their hands are coming up very close to the transplanted zone. So if someone slows down their movements and makes sure that they're in front of a mirror when they're touching anywhere close to their face or their head, that of course will reduce the risk of that occurring. People ask about hat wearing after a hair transplant. A loose fitted hat is okay after 3 days, and a regular hat is okay after 14 days. But let's say a patient wants to fly home the day after surgery and they want to wear a hat. What can we do? So what I usually recommend is to place the surgical cap on first very carefully, and on top of that to place a loose fitted hat. We recommend hats that have a Velcro back to them so that you can put them on a very loose setting. Like these Feel Confident hats, where on the back there's a Velcro strap, like so. So you put it on a loose setting and you can just place it very carefully over your surgical cap without messing up and disrupting your grafts. So then people at the airport won't really fixate on your appearance because now you have the surgical cap and you have a hat that's carefully placed over the head. And these hats are conveniently available on the Feel Confident website, so check them out. And as far as showering goes, it's okay to take a normal shower at day 6, but we do recommend using baby shampoo through day 14. How about activity? Well, we recommend light activity for the first 6 days, with absolutely no sweating during those first 6 days. Regular activity is permitted after about 2 weeks, and swimming and sauna can start after 3 weeks. For more detailed post-operative instructions, make sure to check out our video below. So take some time to heal appropriately after a hair transplant. Try to reduce your chances of dislodging grafts post-operatively. I really hope Eugenio's grafts survive this ordeal. Hopefully he'll be happy with his result and it'll all be worth it. What are your thoughts on Eugenio's situation? Should he have been kicked off the flight, or should he have been allowed to stay on to get home? Let me know your thoughts in the comment section below.